I'm Luke Schellenberger. I'm an ear, nose, and throat doc. I'm going to talk a little bit about sleep apnea or obstructive sleep apnea, which is the most common type of sleep apnea that I see. I have a lot of patients come in and say, "Oh, doctor, I snore, but I don't think I have sleep apnea because my bed partner, my wife, or my husband says that I don't stop breathing while I'm sleeping." Well, that's really not the way that we can diagnose sleep apnea. Somebody can look at you while you breathe all night long and never see you stop breathing, but you could still have it. Sleep apnea is more like high blood pressure. You can't really look at someone and know they have high blood pressure, be able to tell exactly how high it is. And the same thing goes with sleep apnea. When we are sleeping, if our body is not getting enough oxygen because we can't get enough oxygen to our lungs because of obstruction in our nose and our throat, our oxygen levels will drop and our body will have to try to wake up a little bit. And so that can happen over and over and over throughout the night. Again, we won't be able to know if we have it. Now we'll have some symptoms of it. We may feel sleepy during the day, or we are told that we snore like somebody sawing down a large oak tree. But the only way that we can really identify, one, if we have sleep apnea, and two, how bad it is with a sleep study. Sleep studies used to have to be done in sleep labs with a technician who would watch you sleep. It's kind of strange. And that still plays a role for some patients. But for most patients, easy way to tell if we have sleep apnea or not is through an at-home sleep study. These home sleep studies have really come a long way in the last 10 years. And they're easy to do, easy to tolerate. You're sleeping in your own bed, doing your own routine, but really can tell us, one, again, if we have sleep apnea and also how bad it is, because there are big differences between mild sleep apnea, moderate or severe, just the same like high blood pressure. And the reason I use the comparison to high blood pressure is because they have the same sort of stress on the body. And somebody who has high blood pressure that's really severe, if they don't get it treated, they're going to have a lot of heart problems, going to be at higher risk for heart attacks and strokes, and that's actually exactly the same sort of problems that can happen with someone who has moderate or severe sleep apnea that goes untreated. And so if you are a snorer, or if you don't feel like you sleep well and you are tired all the time during the day, give me a call. Let's get you set up for a sleep study, figure out what's going on, and work from there.